Okay, everyone, I think we can get started then. Welcome to all of you joining online today. My name is Ann Lang. I'm the Executive Director of PHAP, that's short for the International Association of Professionals in Humanitarian Assistance and Protection. I'm delighted to be serving as your co-host today for this webinar on security risk management and duty of care during COVID-19, organized by ICVA and PHAP. This is the first event in a new learning stream on risk management in practice. I'm joined today by my co-host, Jeremy Rempel, Head of Humanitarian Finance at ICVA. Over to you, Jeremy.
Thanks, Ann, and pleasure to join you as co-host on another one of these webinars. And as you said, kicking off this point on security risk management, and in particular risk management in practice, which I think has been a timely topic in a number of ways that we'll hear more about this morning. So we're looking forward to engaging in this discussion and carrying forward this important topic as well. And for those of you that don't know me, as you heard from Ingrid, I'm Jeremy Rempel, Head of Humanitarian Finance with ICVA, and we're working significantly in this area of risk management as part of our broader work on not just humanitarian finance in specific, but also looking at donor conditions, relations, contractual obligations, etc. So pleasure to be here this morning.
Excellent. Thanks a lot, Jeremy, and very exciting to be launching this new series. We're looking forward to all of the events that are coming up, not only today. But before we start the session, I'll just quickly go through a few technical aspects of the platform for those of you who are new to the platform with us. First of all, and importantly, if you encounter any technical problems with the platform, in particular if you find delays with your audio or your visuals, you can feel free to jump over to one of the backup live streaming options that we have set up through YouTube. These do use less bandwidth, so they can be more accessible in that way. However, note that they do not allow for the same level of interactivity with the chat and the polls. But to connect to them, just follow the links that you see now on your screen. And if you need to see those links again at any time during the event, you can just mention that in the chat, and my colleague will be happy to post those again in the chat so you can jump over to the live stream anytime you need to. I'd also like to highlight that we do offer closed captioning for this event. At the bottom of the screen, you can see a box where the captioner is currently typing all that is being said in the event. On the far left of this box, you can customize the font type, color, and size. And in the center, you can click the small arrow to hide the formatting choices if you'd like. This gives more space to the actual text of the captions in case you want to have more space to see the text. And I'd also like to highlight, very exciting, we're testing automatic translation of the captions in today's event. You can change the language of the captions by using the drop-down selector in the middle. So the default is set to English, but you can drop down to choose French, Arabic, or Spanish. So do feel free to give that a try, and very happy to get your feedback on the functionality afterwards, of course, this new functionality. Next, you will be seeing some snap polls coming up during the session. These are to gauge your views or experience. You should now see 2 test polls displayed as an example. Just click on the response, or for free text polls, as on the right-hand side, click on the text box, enter the response, and click submit. And note that in the polls, your answers are always automatically anonymous. Finally, if you have any questions for the speakers at any time during the session today, you can submit them using the Ask a Question box in the lower right-hand corner of your screen. And for the questions submitted through the Q&A box, if you'd like those to be posed anonymously, please make a note of this when submitting your question. Otherwise, we will mention your first name. So with that, we will turn to the substance of today's event. In today's session, we'll be looking at security risk management and duty of care. This is a topic that's come into stark relief globally in the COVID-19 operational environment. Before introducing our panelists, I'd like to turn back to Jeremy. As mentioned, this is the first webinar in a new series on risk management in practice, and I'd like to ask you the question, Jeremy, why is it that humanitarian practitioners need to learn more about risk management? What motivates this series in that sense? Over to you, Jeremy.
Great. Thanks for that, Ingrid. I have a couple of slides I'll share in response, and I think a number of people probably present here have been engaged already in some of the background work that we've done on risk management in general, either joining in one of our kickoff broader events to the series or our annual conference. But just a couple of points to run through quickly here on the screen. So I think, and these I think should be evident to all of us. So by definition as humanitarians, we're in fact working in some of the most difficult contexts, seeking to assist people in the greatest need. And so risk is an expected part of that work. It's inherent in those contexts we're working in. It's always present in some form in the humanitarian world. So it's in fact a natural part of our sphere of work. So knowing that risk is always present, I think it should be evident as well that good management of it is also a key part of how we act in that space. So good risk management, it's just a basic element of a well-functioning humanitarian organization. And I think to highlight on the screen, the bottom line is when we manage it better, we're more effective at serving the needs of people, which should be part of the core identity of a humanitarian, certainly a humanitarian organization. I'll come back in a little bit when we get into our discussion on zero risk, though, because I think there are some deeper issues there to unpack. And secondly, very quickly, I think I just wanted to highlight as well in that some links to the broader risk discussion. So today, obviously, we're here talking about security risk management, duty of care, but there's a few links to the broader risk discussion. So risk management is cross-cutting discipline that cuts across all relevant areas of our work. It can be applied not just, as we'll talk about today, in security risk, but more broadly, pretty much to any area of our work. So a very cross-cutting discipline. Important that we think about how we work to balance appetite and tolerance, so our willingness to take on risk versus our ability to manage individual risks. I think a broader discussion link around risk transfer and sharing, so how we appropriately share risks between different actors in the humanitarian space. And then as you mentioned too, what we'll get into more today, I think an important discussion to be picked up around risk management, specifically in response to COVID-19 and how we respond to that from a humanitarian perspective. So there's large areas of kind of unknowns across the system right now in a global pandemic. And I think important to note an increased reliance on local partners. Traditionally, those partners are not very well resourced, particularly in some support function areas like risk management, security risk management in particular. So I think there are some unique factors with regard to COVID-19 in particular that are important to undertake today. You mentioned as well, quickly, I can just share briefly a couple points here. So we mentioned this is part of a broader series. So we've had a few different topics that we've put on the table to discuss. We've already initiated some discussion around risk management, both at our annual conference, which had a theme on protecting principled humanitarian action and honest conversation on risk, as well as some initial webinar work done at the end of last year around risk management and organizational culture. Now we're trying to shift into more of a practical series on risk management and practice. So today we get into security risk management. There are some other topics that we'll try and explore in the future around risk tolerance, appetite, zero tolerance, how we use risk tools better. So we can look forward to some additional installations in the series. And then really quick at the end, I think why security risk management and duty of care. We've touched upon this already. But I think good to frame as we get into our discussion today. So obviously these are inherent issues in our work. We have high pressure to work in high risk environments. frequently limited resources for staff care and security. I think we'll see how that comes up in the discussion today. And critical to consider how we manage these security risks and care appropriately for staff. And I think two key factors there. One, I think very difficult to be effective at caring for people in need if we're not also able to care for our own humanitarian workers and staff. So both are critical. And I think second, I hinted at this earlier, managing risk well does not equal zero risk. We could spend infinite resources managing risk down to zero. That's not part of the goal. So critical to look at the balance here of how we manage risk well, knowing that risk is part of the inherent environment in which we work. So a couple of points to consider as to why we look at these issues. Right, I'll pause there.
Perfect. Thanks a lot. Thank you very much, Jeremy. And yes, as Jeremy mentioned, for those of you who may be looking for an overview of the topic, ICVA and PHAP organized last year an introductory session, and my colleague is now sharing that link in the chat to the recording of that event in case you'd like to go back to view that recording as well. So again, I encourage everyone to engage in the discussion today in the chat, to submit your questions throughout the event. We will ask our panelists if they are willing to answer any questions afterwards if we don't have time to discuss them during the event. So we'll seek to have some answers in writing after the event for any additional questions. So please do submit anything that comes to your mind. So now to introduce our panel. Today we are joined by 4 speakers who will be sharing their perspectives on security, risk management, and duty of care. First out is Lisa Riley, Executive Director of the Global Interagency Security Forum, who will be providing an overview of security risk management in humanitarian work. Great to have you with us, Lisa.
Really nice to be here. Thank you for inviting me.
Our pleasure. We'll then hear from 3 speakers on how their respective organizations are approaching security risk management and duty of care during COVID-19. First among these, joining us from Pakistan, is Azmat Khan, Chief Executive Officer at the Foundation for Rural Development. Welcome, Azmat.
Hello all, and I feel privileged to be among you and such an amazing audience. Thank you so much for inviting me.
We're so pleased to have you with us, Azmat. We'll then have with us Stefan Maurer, who is Geneva representative with the Danish Refugee Council. Thanks for joining us, Stefan.
Yeah, thanks for the invitation, and congratulations to all of you as risk managers. If you look at my picture and you didn't get scared, I congratulate you.
Excellent, thank you. And finally, we're happy to have with us Tom Metcalf on the line, who will be sharing how the World Food Programme approaches these issues, looking in particular at security risk management. A warm welcome to you,
thanks.
Tom.
Good afternoon to everybody, and looking forward to this.
Great. So now let's turn back to Jeremy one more time from ICVA to help set the stage for today's discussion. ICVA recently published a briefing paper on security risk management in international and local NGOs. So let's take a look now at what were some of the findings from this paper that are specifically relevant for today's discussion. Back to you, Jeremy.
Great, thank you, Ingrid. And I'll be happy to run through very briefly, I think, a few of what we see as emerging issues, conclusions, recommendations from our briefing paper work here. I think, full disclosure for myself, part of why I'm excited to have this conversation today, although I've spent quite a bit of my career working in the area of risk and risk management, I'm not an expert in security risk management, certainly not at the level of some of the panelists we'll hear from later. So I find it quite interesting myself to dive into this issue and hopefully learn some more ourselves as we seek to support NGOs to better handle issues of security risk management. So as noted, last year we had a research project completed for ICVA by the Graduate Institute of Geneva with a detailed paper published in December of 2019. I think we have at least a couple of our Graduate Institute colleagues here who worked on that, which were Manuel Herman, Sylvan Oberholzer, which was a great background piece of work, and we've now drafted into a briefing paper version that is currently available on the ICVA network. ICVA, see the link there on the ICVA website, looking at security risk management and assessing decision-making processes in local international humanitarian NGOs. There are a couple of key points of focus on this, as you'll see on the screen. So looking at the relationship between security risk management, risk-taking, risk aversion, particularly the institutionalization of security risk management. And the background research relied heavily on a series of key informant interviews with local NGO partners, international NGO partners, as well as both UN, multilaterals, and donor governments as well. So a good scope of work done there, to background work to build into this briefing paper. So I encourage you, if you've not already, to take a look at the paper. I think this morning we want to make sure we have a healthy discussion with our panelists, so I'll really just touch on a couple of the highlights that I see as really linked to the discussion that we'll have today. So in terms of emerging conclusions from the paper, you'll see a few points here on the screen that I thought were helpful to pull out for this discussion. So one, the idea that security risk management can vary considerably from organization to organization based on a number of factors, including size of the organization, structure, I think importantly culture, which typically plays a big role in risk management in general, obviously operating environment, and there is a need to be context specific in how you approach security risk. Second, this was an interesting one to me. Security risk still ranks lower than other kinds of risks, for example, reputational risk, fiduciary risk for NGOs in particular. I think I had a preconceived perception coming in that perhaps security risk in the humanitarian space was actually a greater focus than in fact it sometimes turns out to be, which is something maybe we'll unpack more in the discussion with our panelists. Third, there's a need for a more open discussion on risk aversion and risk transfer. How can we move towards risk sharing? I think this is a key conclusion. This is coming up increasingly as a topic of discussion in general in the humanitarian space. How can we move towards risk sharing? What is risk sharing as opposed to just basic transferring of risks down the chain of funding, for example? So I think a key topic to pick up as well. Fourthly, there's a willingness from some donors to see SRM included in proposals and in budget lines. I thought this was another quite interesting point coming up from the paper. Particularly, there can be a greater willingness than we assume sometimes on the donor side to pick up some support elements for budgeting around security risk management. And we need to be taking advantage of that willingness. And it might be that we need to be more proactive, speaking from an NGO perspective in particular, to take advantage of some of that willingness. And finally, there's different kinds of risks are interrelated in a case for integrated risk management approaches. I think this is another important point. There's a degree to which risk management, as we said in the beginning, is cross-cutting. Important to look across all risk categories. Not all organizations are going to prioritize risks in the same way, but we do need to have a broad approach when we look at risk management. So security risk management, duty of care, what we're looking at today, one component in a much broader need to look across a number of risk areas within our organizations. So I thought those were some key conclusions to highlight as we get into the conversation today. On the level of emerging recommendations, a couple of points I wanted to highlight there in specific. So there's a number of additional recommendations in the paper. So again, I encourage you to have a look at the briefing to get the full scope of recommendations. I thought I would highlight 4 key ones here that I think fit well in particular with our discussion. So one, the need to include context-specific analysis of SRM and ensure that we're employing security procedures, duty of care process that are both feasible and understandable, I think, key to staff in different contexts. So looking both at the context issue, but then also that we're developing approaches that are feasible given the context and implementable in terms of being understood by staff, understood by partners. Second, ensure that project contract negotiations are both more transparent and include particular focus on budgeting for SRM. I think that, again, is a key one where there's an opportunity to work more closely with donors, with our UN colleagues, to make sure there's appropriate budgeting for security risk management, and something that we handle upfront in project proposal work. Third, to ensure that there's context-specific security training for local staff, and that is given an equal priority to international staff. I think, again, I assume we'll hear more about this in our discussion today, but I think really a critical recommendation to consider when it comes to the value we place on training for local staff versus international staff, looking critically at who's most likely to be engaged in security incidents, for example, ensure that there's both proper training and proper resources dedicated for all staff when it comes to duty of care. And then I think finally, to encourage actors involved in policymaking, agenda setting, the global discussions that we have around humanitarian action, to advocate for security risk sharing. I think this is, as I mentioned, really an emerging issue where there's a growing interest in tackling this topic of risk sharing. I think this is emerging in a few different global fora, certainly within the Grand Bargain structure, a growing interest in addressing risk sharing. I know both the Netherlands as a donor and ICRC, Red Cross, picking up this issue in particular, but others as well with a strong interest in carrying forward this discussion around what it looks like to have appropriate risk sharing in the humanitarian system. Right, let me pause there. I think those are the key points I wanted to raise, but really, again, excited to hear from our panelists and get into a dialogue today as well. Back to you, Ingrid.
Fantastic. Thanks so much, Jeremy. That's a terrific way to get us started. So yes, moving on to the panel, I'd like to turn first to Lisa for an overview of security risk management and what we should have in mind when approaching the topic, especially during COVID-19. Over to you, Lisa.
Thank you very much. So security risk management, I think, sorry, just getting used to that. Okay, so just a bit, for those of you who don't know what a GISF is, Global Interagency Security Forum. Up until a couple of months ago, that was EISF, the European Interagency Security Forum. We are an NGO peer support network for the global security focal points of our member organisations. So we don't tend to get involved in the day-to-day risk management issues at a country level, but it's much more around policy and strategy level discussions. We are recognised as the Centre of Excellence for Security Risk Management in the humanitarian and aid sector, and that's through the events we run and those we support, the research we do, and that's both original research but also developing practical good practice guides, and to act as a resource for the sector, not only amongst our members but to help others to get a better understanding of what security risk management is about. We currently have 116 members from across Europe and North America, but since we've gone global, always looking for more people to join us. I think one of the things to start with to me is, what are the perceptions when people talk about security risk management? One of the issues is this belief that everyone's ex-military. If you're doing security, you're ex-military. And I think this was very much the case when NGOs first started doing this. They didn't quite know who to employ. But while this is changing, this is still the perception that exists. That security managers are just risk averse. They just want to bunker down, stop people going and delivering programs, that there's really that bunkerization. And it's absolutely process driven. It's very paper heavy, it's a tick box exercise, and it's very much about the plans and the processes rather than discussion. In reality, it's changing, and I think it's changed quite a lot. And primarily what it is about is enabling programs. ISO 31000, the International Standard for Risk Management, talks about a risk being something that stops you achieving your objectives. So if your security is actually something that prevents you delivering programs, it becomes a risk in itself. This is why it's important to understand that it isn't about being risk averse. It has to be inclusive. It's not about one person sitting in a room and developing a plan, but people have to be engaged. More people, the broader the engagement, the better the risk assessment, and really the better the mitigation measures are as well, because they reflect the needs of all of the staff. We have to be transparent and accountable in what we do. And that really leads to that ability of being able to have informed consent. Because if people are not aware of the risks and they're not aware of the mitigation measures that are in place, how can they make informed consent and make good decisions about their own security? And we need to remember who is the owner of the risk. The security managers don't own the risk. They provide support, they provide guidance for the management structure to be able to balance the risks, the program criticality, staff safety, sustainability, reputational risks. And was mentioned by Jeremy, you know, all of these are interlinked, so we need to have a more holistic view in managing risk. And we need to make sure it's a people-centered approach, that we're moving away from a tick box exercise, and it really makes the most of the people we have. We know everyone's different. If we work together, we're much, much stronger than just a group of individuals. So how do we really bring that into security risk management? And I think this has been one of the issues that we face when we look at historically how risk management has been done. The idea of everyone being equal has meant that everyone's treated the same. Now, we're not all of the same. Each of us has different experiences, gender, ethnicity, all of which have their own challenges and their own strengths. So we need to make sure that we treat everyone with equity, but without assuming we're all the same. The question about security risk management in the sort of the current situation with COVID-19, my feeling on this is, assuming we have this approach which is person-centered, is very context-specific, as Jeremy was mentioning, that we're flexible, we recognise it's not one size fits all, and we are responsive in terms of our transparency and accountability, that system can deal with all sorts of crises, including the current one. Not saying it's easy, but the ways of working are there that can manage it. One of the papers that we're working on at the moment is this security risk management from the local partner perspective. And I think, you know, again, as Jeremy mentioned, as the response to the pandemic is we are putting far greater reliance on our local partner organisations. This is critical at the moment. And it's very interesting, again, what Jeremy was saying about risk sharing. We talk a lot about risk transfer, but during the research that was undertaken, it became very apparent that not only the local partner organisations, but also the INGOs had very different understanding of what risk transfer meant. And we need to be very clear that as soon as we work in a partnership, we're actually changing risks. They're going in both directions, and risks are generated by that partnership. So we need to be much clearer around what are we doing when we talk about risk transfer. What also came out very strongly was that the national NGOs were very guarded in expressing their concerns around safety and security, because there was a lot of fear that they would lose funding if they expressed any concerns about their ability to work because of security risks. And again, that need for sharing information. And one of the issues certainly around security is how do national NGOs really have access into those sharing information platforms. And finally, as was mentioned before, resources. And it's interesting, I mean, a lot of INGOs are not very good at ensuring that sufficient resources are included for their security risk management. So in a way, it's not surprising that that problem is also occurring with the local partner organisations. So if we're going to change our organisational culture to one where security risks are managed, that we're not averse, that we really sort of tackle them for sustainability, that has to be led from the top. Policies have to be implemented consistently. We often come across situations where it's different between sort of senior management and the majority of the staff, between international staff and national staff, international organisations, local organisations. There needs to be some consistency so everyone understands that it's about them, it's inclusive, and it's not exclusive. And again, Jeremy mentioned this thing, the factor about security risks often not being given the same priority as other risks. And this is certainly something we found with a lot of organisational boards, that as part of their induction and training, they get information on the legal risks of the organisation, the financial risks, reputational risks, but often the security risks, staff safety, is not something that goes onto the agenda as part of the induction and training for board members and senior management team people. A lot of organisations have a champion on the board level, so not everybody has to become an expert, but there's at least one person within that board making sure that staff safety is something that is regularly appearing on the agenda. And just finally, some tools and resources. As I said, we like to think we have most things that you might need on the website. There's our own guides, but we also do act as a storage for other documents that we find useful that are created by others. And in particular, at the moment, there is a theme around COVID-19 and various documents there that are useful, we hope. Thank you.
Great. Thank you very much, Lisa. I have a question that's come in for you. This is from Kingsley, who's connecting today from Nigeria, wondering how can we bring forward this discussion with donors to enable this discussion to materialize into commitments in terms of budget design. So how can we progress with the discussion with donors to ensure that the measures that you're talking about and how security and risk management should be, how we can ensure that there are also funds, that there's donor support to make that a reality? What do you say, Lisa?
More and more donors are accepting that security risks have to be recognised, and in order to operate safely, obviously resources are available to do that. And often DFID, the EU, to name a few specifically, have those budget lines built into their proposals. The problem often lies with the NGOs themselves. One of the things that we find is often security managers don't actually know how to put a budget together. Security risks are often buried just within the overhead. So it's very difficult for donors to fund something if it's not actually identified and what the costs are for and how you're using those in order to get safe and sustainable access to the program. So one part is the donors, but also within the organisations themselves, we have to get much better at actually identifying what those costs are and making sure that they're clearly identified in proposals so that donors can see what actions that we're taking. We did a paper a few years ago called The Cost of Security Risk Management, and there's a very useful tool in the back of that which identifies all sorts of things that you might consider as security costs. And we know a few organisations who've started doing that, which has really made them be able to go both to their internal managers and people preparing the proposals and going, these are really the costs that need to be included. And that gives us a much stronger position to go to the donors and say, this is what we need.
Excellent. Thank you so much. Very interesting, in particular, to have you point to that practical tool. I think with the specific kinds of costs that can serve as a point of discussion in developing budgets and presenting to donors. Very helpful indeed. I'd like to go over to Jeremy. Just to get his thoughts on the same question regarding progressing the discussion with donors. Over to you, Jeremy.
Yeah, thanks, Ingrid. I would echo as well the points that were just made. And I think maybe one thing to highlight is, thinking about a two-pronged approach at the field level, I think this point we just heard on asking for it is important to highlight. I think in our own work that was done by the Graduate Institute, one thing that was clear in some of the interviews was that on the donor side, the ask from NGO partners was not being made clear as much as it could be in the upfront proposal process. So very important to be clear upfront on the NGO side when we're making a proposal, putting together a project agreement, that we put the ask in there and clearly budget for security risk management. It might not be allowed in all cases, but we have to ask for it increasingly to make sure that that's in there. And I think second, at the global level, we have a very mixed participant group here, mixed panelists. Certainly those of us that engage more in global discussions, whether it's Grand Bargain or other fora, important that we pick up some of these points around risk management, risk sharing more broadly. I think that's an avenue as well to ensure that some of these concepts then can be developed into more clear policy options that also feed into supporting the field from that more global level of the policy base. So I think two prongs there that I would highlight. And maybe quickly, we're just tracking some of the polls that come through as well. I think quite exciting to see some of the responses that actually I would say we have quite a progressive group when it comes to understanding some of the, I think, more positive characteristics around security risk management being based on inclusivity, risk ownership, people-centered approach, etc., versus some of the more stereotypical driven approaches that Lisa was just sharing. So good to see that from a group that we have. It seems an expanding, as we engage in these discussions, and increasingly expanding understanding of what it looks like, at least, to have good risk management practices.
Very good. Thanks a lot, Jeremy. Lisa, I have a number of other questions that have come in. I'd like to pose two more quick ones to you, if you don't mind. I'll pose them together and then we'll move on. So one is from Moses, who is wondering, how can an organization standardize security risk management across contexts, considering how vastly different risks are in different contextual environments in which INGOs and national NGOs work? Are there any handy heuristics one can adopt and use? That's from Moses in Tanzania. And then a second question I'll tack on to that. This is from Eddie, who writes, in the context of COVID-19, how can INGOs be guided towards making the right financial forecasts for security risk management, knowing that the situation is very fluid and changes rapidly? So those are to you, Lisa. Back, you have the floor again.
On the first question, I would be very worried, to be honest, if an organisation tried to standardise their security risk management across all contexts. I think what you can standardise is an approach, guidance, ways of working, but everything has to be so context specific. And I think this is one of the reasons why some organisations did get into sort of problems with this stereotypical perspective, was they tried to create a one-size-fits-all solution. And I think it's much more around creating an environment where organisations at a country level are empowered to have those discussions around security risks within a framework that's provided that makes sure that the organisational duty of care requirements are met. And also I think what's important is that there are some sort of standards set so it's easier to compare different countries. So when you're looking around allocation of resources and needs, there is a means to compare between different contexts rather than standardization, if that's clear. On Eddie's question around the right financial forecast, very difficult question to answer. I think it's the more we try and understand it and unpack it, I think the recognition around ways of working having changed, the reliance on local organisations and national staff, and making sure that there are sufficient resources available for them, which is often neglected. Apart from that, it's something I think I will have to think about some more. But I think you're right, there's so much at the moment that's very difficult to forecast, as we're not sure exactly how the pandemic is going to unfold. I'm sorry, I can't give a better answer to that question.
No problem at all. Thank you very much. So now we'll be moving on to hear from Azmat, who will share the perspective of his organization on how they are approaching security risk management and duty of care. Azmat, you have the floor.
Hello, good morning, good afternoon, good evening, wherever you are according to your context and where you are currently staying. My perspective on security risk management and duty of care will be more from the perspective of a small to medium level local organizations, and specifically this will be in the context of Pakistan. So the local NGOs generally they are exposed to more risks than UN agencies and international actors for various reasons. They have to be near their humanitarian operations. Even their main offices are many times supposed to be near the humanitarian operations. Then the COVID-19 has further increased the risks for local NGOs because the communities and the local government departments expectations have increased from the local organizations, and they are struggling to find resources, and they are struggling to raise awareness, and all these things have exposed the increased the risks for local organizations. If we look into how the security risks have increased from the perspective of the communities for the local organization, number one thing is that many of the communities in the least developed countries, they are still in the denial phase. They consider corona to be just some media hype, and if they do not have access to reliable information on what COVID is and how to protect yourself from it, and there are no access to internet, social media, and mainstream media in many of the areas, then the volunteers and the staff of the local organizations, they do have to go there and work with the local community. So the risk is increased many a times for the local staff and the volunteer. And this is further complicated by the fact that the supply chain of the personal protective equipment, it is already overburdened, and local organizations, they do not have enough resources to procure the costly PPEs. Many a times, even if I'm giving just an example, if a face mask is supposed to be used just for 2-3 hours, but the staff of the local organizations do not have access to more PPEs, so they use it again and again. And similarly, like from the government perspective, in many areas, the lockdown and the loss of job has pushed a lot of people to be vulnerable to acute food insecurity. And the local government departments, they expect from the NGOs that they will deliver some sort of relief. Specifically, they are sort of expecting for more a hardware-like relief. So the NGOs are increasing risk because they have to gather information and they have to maneuver through the civil space which has already been shrinked in Pakistan. So that is yet another risk for the local organizations from the government perspective. With regard to already the funding which is already present with the local actors from the UN and other international sources, many of the UN agencies, they have sort of put their programs on halt due to COVID because some of the activities they cannot take place in this new normal. And some of the projects which were planned well before the COVID struck anywhere, and they materialized just during this COVID. So those programs have been put on halt. And when it comes to the duty of care from the local organizations, they have tried to take on board people with them for implementation of those projects, but they cannot start the implementation of those projects because the COVID has made it sort of very difficult to achieve the results which were planned for a normal situation, but now the situation is of COVID. So that is one other risk for national and local NGOs. Then specifically in context of the COVID-19, the NGO's own programming and to keep with the expectations of the communities and the government, it also poses some risks like as of now, we are in Pakistan, it is already late evening, sort of 2 hours after the normal business hours, but it is just getting morning in some parts of the world. So the local NGOs staff had to stretch themselves to this need of being connected with the international community as well as the local stakeholders here in Pakistan. So many of the, if I talk of myself and a few friends of mine to whom I talk frequently, we have to had a working hour of 14 hours or 15 hours sometimes because the local meetings here in Pakistan, they usually took place somewhere in the morning, but the international meetings and the webinars and discussions, because they have to take care of the entire world, so they had to stretch their expectation, and it sort of resulted in the burnout of some of the local NGOs staff members. And now coming to what are the reasons of why the local NGOs are more vulnerable to the security risk and they are sort of weaker or cannot fulfill the expectations and duty of care. So number one reason, in my opinion, is that there had been no investment in the institutional capacity of the local partners. They have been more used like a subcontractors, where they have implemented a project of a UN agency or an international NGO or some other international actor, but the funding came just for achieving the very specific results for the projects, but no resources were invested in the capacity of the local organizations. And then there are some cultural reasons as well. Number one is that because most of the local organizations have originated from the local communities, and they cannot actually create that, if we can call it, a safe distance which the international organizations and the UN agencies can practice. The UN agencies and international organizations usually, they do have their offices in compounds with the heavy security and all these things, but the local organizations, they cannot practice those things, and they have to keep in touch with their local communities. But then the partnerships arrangement, like if a UN agency or an international organization is entering a partnership with the local organizations, they are more interested in achieving their own results which they have put somewhere in their logical framework. But the security risk management for the local partners or duty of care is usually not the part of the logical framework of the intermediary UN agencies or international NGOs. So that is one of the reasons. And now coming to what we suggest to improve the situation in terms of security risk management and duty of care. So more of a partnership approach for the local NGOs with UN and other international organizations. Like the locals should not be used just as a subcontractors, but they should be considered more like a real partner, and a real partner is which, in addition to achieving the results of your project, you are also investing in their capacity. You are providing them the core funding. Like this COVID, it sort of caught the local organizations in a situation where we were on ventilators ourselves. The humanitarian phase of the internally displaced people had phased out, and the government expectations were like this, that the NGOs will now bring some resources. So core funding is one of the solution to these risks. And that this is already discussed in the previous point, but again to re-emphasize that partnerships should not be only on the deliverables of the project, but it should be more like enabling the local actors to invest in their capacity to take care of the security risk as well as the duty of care for their staff. Sometimes this is considered that, okay, we have provided a training to local organizations on proposal writing and resource mobilization, but a real partnership would be sharing that social capital and linkages of the UN agencies and the international organizations with the local organizations, so that they can they can mobilize the resources themselves, and they do not need to rely on the international organization and the international. Some of the UN agencies and the international NGOs, they do have resources, like they do have the psychosocial counselors, specifically when it comes to the duty of care and managing the work-related stress, but the locals do not have that access. So if the local organizations could be provided an access to the existing resources on security risk management and duty of care, that will be of help. And here in Pakistan, as well as I do not know about other countries much, but even the intermediaries are considered donors, that okay, these are the donors of this project. So if there is a system that increases the accountability of the donors or funders or intermediaries, that okay, you have funded them for achieving the results of this project, so how much you have invested in their security risk management capability. Some of the presenters today, they discussed this thing that the security risks are sometimes not shared by the local actors or smaller actors because they considered that if we share these risks, we will be excluded from the due diligence process and we will not get funding. So let's make it quite an honest and very clear communication that the donors, the intermediaries, the UN agencies and international organizations, they do realize that the local actors are facing more risks compared to us, and we should invest in their capacity to respond to these risks. With this, I offer thanks to all of you. And if there is any question, I'll give the question and answer later on. Thank you.
Okay, perfect. Thank you so much. Yes, we should hopefully have some time for Q&A at the end. In the meantime, we have one particularly timely question. If you don't mind, Azmat, I think I'll pose that to you now. This is a question coming in from Howard in the UK, and essentially he's asking about whether in your context in Pakistan, are there any good examples of country level engagement that you can point to, any examples of good practice in terms of engagement at country level between donors, UN, INGOs and local NGOs, specifically to scale up funding to local NGOs, addressing risk appetite of donors and international intermediaries. So understanding, of course, that there are tremendous challenges, as you pointed out very eloquently, and also as was highlighted in the poll results that were coming in during your presentation, we saw that the vast majority of participants today agree that in their experience, the gap the risk gap between UN agencies and INGOs and between INGOs and local NGOs has increased. So local NGOs are taking on a far greater amount of risk now in COVID-19. So understanding that there are tremendous challenges everywhere, and certainly in your context in Pakistan, are there any good examples of good practice that you can
Thank you so much. That is really a very nice question and very relevant to this context. When it comes to the collaboration of the UN, international NGOs and the local NGOs in Pakistan, we do have a very good working relationship among these three actors. But when it comes to the practices where there had been some investment in the security risk management or the duty of care for the local partners, so this is influenced by the resources which have been made available to the United Nations agencies or the international NGOs who are operating here in Pakistan. There had been some small-scale success stories, you can consider them, that some international NGOs or some international actors helped the local organizations in getting access to personal protection equipment, PPEs, for delivery to the local government who are dealing with the COVID in places of quarantine and all these things. So that helped in providing or improving the civic space for the local NGOs as well as the international NGOs. But this security risk management and duty of care is not just a one-time activity. It needs to be part of a system, and that system needs resources. So we are looking forward to more joint efforts of all these actors, whether UN, whether local actors, whether international actors, so that we can advocate with the donors to make it an integral part of the programming, and the security risk management and duty of care actually becomes institutionalized, and it is not considered just a one-time activity that has already taken place. So that I hope I have addressed the question a bit.
Absolutely. Thank you very much, Azmat. And now I'd like to turn next to Stefan. As an INGO active in humanitarian response context globally, what has been your experience in terms of security management and duty of care during the COVID-19 pandemic? Over to you, Stefan.
Yeah, hello to all of you. As said, I will try to give you a picture of what has happened and what is being discussed within DRC. I would, however, clearly like to say that this is not neither a deep dive, nor is it something that we are the owners of knowledge. I would like to share with you a relatively fair picture of our discussions and the work in progress that we had over the past weeks and months. Let me, for that reason, start a bit with a picture prior to COVID-19, and then, if this slide moves, and then move a bit to the challenges, see if these responses that we came up were adequate, go a bit deeper in lessons learned, and then perhaps a few points to the donors. If I may come back to the situation prior to COVID-19, I think in DRC we have invested a relatively a lot of money, energy and thinking and everything related to that to come up with a security management system that is kind of solid. We had structures, we have staff in place, we have coordination mechanisms, we have DRC safety maps. You see that on the slide there, more or less every duty station of DRC is ranked from 1 to 6. There is kind of a standard safety training in place that every staff member has to go through according to the duty station they are in. And I think we also have defined the key principles for our work and the duty of care. In short, I think we felt kind of prepared for the regular challenges posing in our posed to us in our regular work. Now, of course, COVID-19 was more than that. And I think one of the challenges that we had at the beginning was, probably as many others, was the grasp of the magnitude. How big is this thing approaching us? How will it affect us? How will it affect us, our structures? Are we prepared for that? And we soon had to realize that we have to escalate the structures we had in place to be even stronger. We had to make a big effort to collect information, which is probably not something we have done in the past in the same extent because we were, and I will come to that point below, a quite decentralized effort. And very soon from the onset, it was clear that we have to focus a lot on HR and the policies around it. An unexpected thing, and probably one of the most challenging for us, was the decision-making power. This wonderful graph on the right should give you a bit of an idea of a decentralized setup as we have been and we still have within DRC. The decisions are, of course, not all taken by our main office in Copenhagen, nor by our Secretary General. There is a decentralized structure in place with regional offices, country offices, field offices, and the different types of managers. Now with a global response or a global challenge, how do you put the structures for decision making right? It's a different situation that we have. There were discussions. Who takes these decisions? What are decisions that need to be taken globally? Which ones can be regional? Which can be country specific and within the country even local? And that was not something we had on standby in our hands to respond to, because this was a different scale of. And one of the main challenges actually was for our main office in Copenhagen. Do they have the power and do they need to pull back decision-making power? Or do we go for a decentralized one? Do we need to have a unified response as an INGO in something like 35 countries around the world, or do we go region-specific, country-specific, or so on and so forth? This was all not that clear. Were these measures adequate? That is a very nice question to ask. In hindsight, I think for DRC internally we would say yes, but, and a very, very big but, because it wasn't that clear and it's still in many places not that clear. For example, this nice statement that we see all over the place, we will also see it on DRC, this message of stay to deliver. That wasn't clear from the onset. That had to come up, that has we needed time to come to that conclusion because it's easily said, a bit more hard to be done. Our appeal, and I'm not referring to DRC funding appeal for funding here, but our appeal was something that was very, very important for DRC internally to define our role, because that was the other part that wasn't clear. What is our role in the global pandemic? We as the Danish Refugee Council, where is our piece? That was not crystal clear from day one. That's exactly what we are going to do. The mechanisms and the responses we were developing were moving ahead more or less as we moved step by step. There was not a crystal clear picture from the day one, okay, in 1 month we will be there, in 2 months we will be there. It was just moving as good as we can with the forecast and the analysis and the picture coming in from the field and the thinking in central levels around it. An integrated approach, and that was another thing that came up very clearly. Safety and security is, of course, a crucial element. There's no doubt about it. But how do we handle that when many, many other aspects are equally relevant? And that gives me the very simple challenge here. Who is the primary, or what is the first priority here? Is it us, our own colleagues, our colleagues in the field, the HR part? Is it actually the beneficiaries, the people that we work for? Is it the program part? Is it the messaging to the international and big decision takers? Is it the advocacy that we are focusing on? And it was one of these elements that we had to deal with. There is not one that can beat the others. It is an integrated approach. They all need to play together. And that is also something we did not just have on standby. Lessons learned, and I would try to spotlight 3 elements here. Define the role of as an organization. And that was for us in DRC. We did a global appeal that we came up, I think mid-April, I say now. That was for us actually the moment where we could then, with the analysis we had in place, with the profile, with our mandate, with the work we want to do, we could say, this is our role. This is how we see it. This is how we see our response within this very, very, very big global threat and global players making very big decisions. And that was a very important thing for us to find our niche. And that's where this stay to deliver came out. This is where the analysis came out. These are the sectors we are going to focus on. These are the regions, and in region-specific responses came out. And that was important because when that was clear, it was also clear what needs to be in place in order to do that. It may sound like a small thing, but it was a very big thing for us to define the role for us ourselves. The next point was HR. We all have HR policies, I would assume, some more defined than others, but we are in total roughly 7,000 people, and we have developed over the last few years a lot of HR policies. One of them was, for example, the right to withdraw. Now, there were many elements to that when the national as well as international colleagues in the field initially did not want to withdraw because they didn't see the threat as serious as it then probably was. However, then when you have the opportunity, miss the opportunity to withdraw and the situation got more serious, we had people stuck. And that is, of course, a very, very difficult situation because then the humanitarian imperative to help the people in need suddenly second priority because you have to get the people out that are kind of your colleagues as a part of the duty of care. So the right to withdraw is a very, very critical thing for DRC, but we also have to have in place kind of an evacuation that we can exercise this right to withdraw. If we cannot get people out because governments restrict movements, it gets very serious. And then you have a real problem at hand. And the other part, and that is one that is probably not that often openly spoken about, but of course there was a major concern regarding national staff. There's a big difference between national and international staff that came up in COVID in our reflections. One is of course the whole question of insurance. Well, national colleagues are, if they're possible, insured through national security insurances. Internationals have another arrangement. We also saw that some countries started to come up with policies where probably nationals would get medical treatment, internationals rather not. So there were different rules suddenly applied to a team that we anyway tried to rather harmonize, but suddenly different rules applied. And that was a difficult one, and is a particularly difficult one until today in countries when there is no insurance policy for nationals by the government in place. And that affects many colleagues who are kind of on the lower scale of the hierarchy, from the guards to the cooks to the cleaners, to all those colleagues that we need in the office to be operational, but then in this moment suddenly have kind of overlooked because we have bigger objectives out there. Another element that was very difficult and remains a difficult chapter is the partners. And I'm not surprised by this 80% who have just said that the gap between has rather increased. I would agree. And one of the elements where I, as an INGO representative, can say we are part of the problem is because we started to look first at our own colleagues. And that is then one of these issues where you have all kinds of competing priorities, and it's not that easy to keep your partners on the very upfront. What we have tried to, with different success, I would say, is to share the information that is available to us, to share that information with donors. Ahmad has just also mentioned that the access to information is not an easy one. But then when we developed our standard operational procedures specific to COVID-19, how much is that fair for us to impose on our national NGO partners? Is it us to tell you that's how you do it now? Or is it up to them to define, is it us to impose, or is it us to support? That is a moving target that cannot be defined so easily. What we also felt, of course, there is a risk that you send the national NGOs to do the jobs you cannot do yourself. And that is, of course, a very, very evil one, and I hope we have avoided that. At least that was clearly the intention within DRC. I don't want to say we have achieved it always, but at least the policy was really going in the direction that we would not like to downscale or move the risk to national partners on the ground. The last point I'm coming here to is what can donors do? And I will try to focus only on a few elements because there's a lot I think donors can do. I think we all, national as well as international NGOs, we need additional support and flexibility. The COVID-19 response is not a standard operational procedure as we had it in the previous years and we just figure it out somehow. That is extraordinary and it can need additional support. I think there is also a demand to the donors to keep a longer view on it and not a short-term thinking. COVID-19 has, of course, immediate health risks, but it will also have long-term recovery and socioeconomic inclusion things. And who is going to be there to implement? Who is going to be there to do the project you want to do? And therefore, I think it's not a very well-hidden secret that some of the situations that come out of COVID-19 can also be risking the lives of NGOs as itself. Do they survive this crisis? Because our funding model is in a serious threat if we have no turnover due to lockdowns. So I think from the donors it's requested to be generous with us, have a longer time view with us, and loyalty. The last point I would like to mention here is to create a supportive environment. We are, I think, too many times thrown into a competitive environment where we have to compete. Our proposals are looked at one compared to the other and so on and so forth. However, especially on security and safety management, we need a competition-free exchange. We need to hear what is working, what is possible, what are the information, what are they doing, and not like this is what you have to do now, but this is what works in some places and this may work for you as well. And I think the same applies also for us when we, as an INGO, talk to our national NGO partners, as when we talk to our donors. Please give us time and ability to develop and respond to our own models, our own way forward, rather than imposing analysis, and this is the way you do that. I will stop here and yeah, remain put.
Okay, very good. Thank you very much. We do have several questions that have come in, so I think we'll have time to pose one of those now. We'll see if we have time for more at the end. I'd also like to just briefly highlight the results of the polls that we ran during your presentation. Very interesting to see. I think a lot of the practitioners and the organizations represented in the event today also find themselves having an important learning experience now in the context of COVID-19, and that we saw when we ask about how well prepared people felt their organizations were for regular challenges in terms of security management and duty of care before COVID-19, there was almost half, 44%, feeling that their organizations were well prepared, and another 40% feeling that they were somewhat well prepared. But then when asked how their organization's preparedness actually was in terms of the onset of the COVID-19 pandemic, were they well prepared for this particular type of challenge, we found that only 27% found that their organization was well prepared. So certainly some lessons learned across the board there. So we have a question for you that's come in from Leah in the UK, asking, how can we improve collaboration within organizations so that security departments work together with HR and other departments to improve staff care and security? This is an issue that you touched on, of course. I wonder if you have any additional thoughts, advice from your own experience that you could share. Thank you. Over to you.
I think that is a point probably Lisa is very well prepared to respond to. I do know that many of the DRC colleagues in the field actually are in close contact with other NGOs and NGO security and safety colleagues. And there is kind of a formal or informal network of sharing happening there. However, I think that is not always taken up as a very systemic response that we could really lean to. I felt, and that is of course my perception itself, many of times when it came to global or regional policies, we did very much an internal analysis rather than the most adequate checking with other partners. We are probably also closer to some NGOs for also personal affiliations. We know each other, we talk to each other, so on and so forth. But I think that does take away from the richness of such an exchange that could happen. But I assume, Lisa, you may be better prepared to respond to that, or do I put now you on the spot?
Lisa, would you like to come in on this question of coordination?
I think that it's a valid point, and it's something that hopefully we will take as a long-term learning from COVID-19, is that we've got to start moving away from the siloed approach to how we work, is that the overlap between security risk management and HR is essential if we're going to respond to these sorts of crises. I think we are seeing it happening, and it will be nice if we can retain this learning as we move forward and not do what we have a real tendency to do, which is to forget as soon as things disappear out of the rearview mirror. And as GISF, we are working with CHS to see if we can start formally bridging that gap between security risk management and HR. Thank you.
Great, thank you so much, Lisa. Stefan, I'm coming back to you with one more quick question. This is coming in from Bidzina, who's connecting from Democratic Republic of Congo. So, question to Mr. Maurer. She writes, what about a dilemma in terms of security risk management in the perspective of stay and deliver versus the risk of perception of humanitarians within local communities, that humanitarians are the main vectors of COVID-19, especially in rural and hard-to-reach areas? Any perspectives on this dilemma raised by Bidzina? Back to you, Stefan.
Good Lord, that is a very specific one. I am afraid I will not be have a lot to say on that. We did get very few, some but relatively few incidents where aid workers were actually seen as one of the main spreaders of COVID-19. I think the far bigger dilemma for us was always this the humanitarian imperative of focusing on the people in need. That's why we are there, versus the duty of care of taking care of our own colleagues and our partners to the extent that was possible. I think that was for us the by far bigger debate and the far more one that we felt from a central level we should have something to say and something to do about. It was difficult for our field colleagues to get messages from the central level saying rather withdraw, rather go back to a safe place. We are worried about you. Well, some of them felt it is not as traumatic as it is, and we are safe, and it's our job and it's our mandate to stay here and deliver aid to those. That was for us the bigger dilemma than the actual reputational risk or the perception of some communities that we are actually contributors of the virus.
Got it. Thank you very much. And now we'd like to turn on to our final presenter, Tom, who will be sharing some important aspects of how the WFP and the UN system works. Tom, I understand that medical and wellness issues are handled differently from security issues within the UN, and that both security and medical are different aspects of the overall duty of care of the UN towards its personnel. Before your presentation, could you comment on that?
Yeah, sure. Thanks, good afternoon to everybody. Yeah, I think some of us bigger organizations are in a luxurious position of being able to have different divisions that deal with both security and medical. And so within the UN, you find quite a cleavage between the two activities and letting the specialists get on with each of their different activities. But I know that is not always the same in some smaller organizations where you might find people double hatting and doing both security, safety, medical, medevac activities themselves. But no, within WFP we have a wellness division that has a medical director, and they have the full responsibility for medical response. And we have a security division with a security director, and we take care of the security side of things.
Got it. Okay. Great. So then I guess over to you again, Tom, to proceed with your presentation. And thanks for clearing that up at the beginning.
Super. Thanks very much. Well, I thought I'd try and share this afternoon some of the bits and pieces that WFP has been doing with its response to COVID. And before we do that, I think we need to make a small dive into the Byzantine world of the UN Security Risk Management Structure, UNSMS. As you know, WFP is a UN program, and for the last 20 years we've been functioning under the UN Security Management System based on a framework of accountability defined all the way from the UN Secretary General himself right down to the field level. And the responsibility for the safety and security of UN personnel is very well defined within with this whole structure. WFP nests inside the UN system, so for our 18,000 or so personnel, everybody falls under the umbrella of the UN Security Management System. And when you consider the scale of our operation, it's good to have something structured like this that guides us. We have presence in around about 90 countries. We have 90 million beneficiaries and a budget, or estimated budget, of around $9 billion. So in a response to this, we've developed our own unique WFP style. Being part of the UN DSS system doesn't stop us from having our own security structure. So we have a three-leveled structure with the headquarters, the regional bureaus, there are 6 of them around the world, and the country offices. There are 90 in total, but only 30 of those we actually have security professionals posted. I think our security division now, we have around about 200 security staff deployed around the world, and 20 or so here in headquarters. I think the specific challenge with COVID wasn't so much initially in the field, it was here in Rome in the headquarters. As you know, Italy has been quite badly hit in this initial stages of the COVID pandemic, and that created quite a few problems for the functioning of the headquarters initially, but our alternative work modalities and the business continuity plan kicked in pretty quickly, and everything has been functioning fairly well so far. So how does it function across the UN? Well, the focus is very much on creation of security plans at the country level. In the old days, there's something that some of you might have heard of called the MOS, the Minimum Operating Safety Standards, and that was a rather clumsy tool that was supposed to apply across the whole of the world, so every single country was supposed to comply with it, which was a bit of a mess, really, to be honest. So the new SRM was brought in a few years ago, and that is very much focused on specific UN security measures being defined at the country level by the security management team, in which all the UN agency funds and programs participate. So we have a sort of a democratic, country-specific process. And to back that up on the WFP side, we have a system of overview of compliance. So when security measures are created in a country, we have our own teams that go out and we conduct about 30 or 40 missions a year to look at and gather data on the compliance with the security measures in those countries. So we're gathering between 10 and 15,000 points of data a year relating on security compliance with the UN system. And I checked this afternoon on the database, and we have around about now 91% global compliance with security measures. So it gives us an ability to look across the world and see exactly are we fulfilling our organizational need to comply with the UN system. So I just mentioned already this thing about security and medical wellness responsibilities. As you say, sort of we render to Caesar what is Caesar's, and we deal with security, and we let our medical division cope with focusing on the COVID thing. But of course, security is very much supporting our medical and medical division in dealing with this. So if we look to COVID challenge itself, let's focus a little bit more on what we actually we had to face. The most important thing was we had very, very quickly from the beginning from our senior management a very clear definition of our mission, and that is the sustain existing missions and scale up new missions to assist WHO, for example, in meeting the new challenges. Of course, it doesn't mean that any of the old security challenges went away. I mean, conflict, armed conflict, criminal events, they've not disappeared at all, and in some countries we've seen a deterioration of pure security situations. So having to cope with one thing and an additional workload posed by COVID has been quite a challenge. But we've had there's a number of things that have helped us to function quite well in this. And the first thing is this sort of the depth that we have within the WFP structure, our operational depth, with having HQ, country, and regional bureaus, means there's a degree of devolved operational autonomy down to the regional bureaus and the country officers, so they're able to get on as best they can with setting up and running their own plans without waiting for detailed instructions to come on high. For example, each of our 6 regional bureaus around the world has their own regional security analysts, and they're able to produce analytical papers to support the decision-making by regional directors and country officers in their own area. So by working at the appropriate level with support from above, we were able to very quickly adapt to a lot of the new challenges. Another thing that's been quite useful, and that's some of the flexibility that's built into the UN SRM system. There are country security risk management plans that are made, and they're normally reviewed every couple of years, but they can be supplemented by a system of ad hoc SRM plans to meet changing security situations or specific challenges. For example, COVID. And I'll give you a direct, simple simple example. We've just set up a medical hub and field hospital in Accra in Ghana, where we didn't really have any security presence at all. We simply flew down one of our experienced security officers, and she sat down with the team there, created a specific ad hoc security plan just for that operation, just for that location and operation, had it approved and put in place, so the security risk mitigation measures can be very, very quickly tailor-made to whatever new situation was arising. So this inherent flexibility has been very useful in coping with the challenges from COVID. Maybe to a few more points I could share with you that might be of interest as well. One of the things we looked at was we need to understand better the situation. We need to be able to look forward and have some grasp on where this whole COVID thing is going. Difficult task, I admit, but we adjusted our existing analysis structure to create a new matrix, which is fed into the creation of a weekly report now for our decision makers, information from the field, overlaid security situation information with other concerns, for example, national health vulnerabilities, to give us some kind of hybrid report that blends health, safety and security together. And just some of you may have seen a copy of this, as we've started a couple of weeks ago creating a releasable version of our own internal WFP version to share with Saving Lives Together and WFP NGO partners. So hopefully we can assist informed decision making amongst our partners as well. It's all part of what I like to call sharing is caring. We've also been very much involved. I mean, our security division is completely integrated into the whole modification and adaptation process within the organization. So we are involved in all the new budget modifications that are made to make sure that they are prepped with the resources that are going to enable security risk mitigation to be made in the future as we change and adapt to the COVID challenge. And something that I'm sure all of you are doing as well, and that is our focus on increasing online training and awareness has been stepped up enormously. Our training unit, for example, set up and ran a training brief online for the new WFP country directors that will be deployed in the coming months around the world. So, there we go. So just a few points, perhaps to conclude. WFP has a humanitarian security focus. Personally, I like to call our security officers. I don't call them that. I call them humanitarian security specialists. That's what we try and bring to our specialized function within the whole UN security management system. And that we talk a lot about duty of care. That's a legal area that I'd rather not get into in detail here now, but my feeling personally is that formal duty of care should never exclude efforts to actually care. And I could give a little story. There's a little story now in 1995, many years ago. I just started with the UN in Burundi, and we had what was called a security cell there, where it was 2 or 3 of us working for UNSECORD, which is the precursor to DSS. And we realized very quickly that we needed to work with the partners who were doing the delivering in the field. So we started arranging every Wednesday a 1-hour-long meeting where NGO partner security people were invited to, and we sat and discussed the security situation, and after we had a barbecue and a couple of cans of Coke. And that became the most important focal meeting of the whole week in our sort of routine in Burundi at the time, on working together on humanitarian security. That was in 1995, and I think it's still a valid lesson for today. When in doubt, get out the barbecue, cans of Coke, and start building networks, which is very much an important part of how we think we should be working. Country level specific, of course, we have our systems that enable us to have country specific security plans, and we encourage all our partners to engage and network at that level, at the country, at the regional level, and through me at headquarters as well. The more and wider networks we have between ourselves and our partners, I see that as only a positive thing. The Saving Lives Together initiative, some people love it, some people curse it. We support it and encourage its use. We encourage membership within the SLT. The only way to improve it and make it function well is to be a part of it. And we're very active in, for example, sharing our releasable analysis paper on COVID. Our weekly paper goes out through the Saving Lives Together OCHA network. We're very keen to engage and network together. For example, I'm very glad to see Lisa here with us today. GISF, we regard them as a really valuable partner and enjoy working and exchanging ideas with them. And so, evolution, the future, maybe a couple of questions to leave us with here now. I think we're going to see some accelerated changes in the humanitarian delivery security environment due to COVID and the associated effects. I can tell you already that we're seeing through our own internal security reporting over the last 6 months or so shows an increase in challenges posed by civil disorder and the challenges of delivery of humanitarian aid in urban settings. And we have concerns as well over the number of incidents involving our own WFP NGO partners. I looked at our internal reporting of the last few days, and I've seen there have been 5 quite serious incidents in South Sudan, Somalia, Burkina Faso, Cameroon, Cameroon and CAR involving our partners. And finally, the whole economic turn-down question, how is that going to affect our ability to fund and provide security? This is a grey area that I think we all should be thinking about for in the future. So thank you all very much for listening, and I look forward to questions, network, and interaction in the future. And don't forget, sharing is caring. Thank you.
Thank you, Tom, and thanks for highlighting, speaking of sharing is caring, thank you so much for highlighting the analysis that is coming out now and how people can access that. There were several questions in the chat when you mentioned it, so very happy to know how our participants can get hold of that. We do have a number of questions. I have two that I'd like to pose to you. First is from Asim, who's connecting from Turkey. He writes, question for Tom. As most of the UN is now teleworking, it's possible that this may become a routine modality of work for many functions in the UN and for long into the future. How do you see this impacting the security of staff?
I mean, it's
back to you, Tom.
It really brings into question not just security of staff, but I think also mental well-being and social well-being of staff as well. The total, what you might call fragmentation of identity into individual homes, and how to provide security in those homes as opposed to a workplace. I don't know. It's something we are looking at right now. There's within WFP we are circulating questionnaires through the HR networks and through security networks and through wellness networks to better try and to get feedback from the field to understand what challenges people feel. But yes, it might need a substantial rethinking of how we operate in the future. I wouldn't like to go any further than that, but I'll certainly say yes, it preoccupies us greatly, and we're looking at this very, very closely.
Great, thank you. And now a question from Neil, who's connecting from Jordan today. He writes, even before these times of COVID-19, security risk management was not seen as an integral part of programming. So this is from Neil's experience. Some of this was due to a poor understanding of what SRM is on the part of senior management team, but some of the issues are have to do with the types of security managers employed. Is it time to bring more people in from non-traditional security backgrounds and to have a more diversified and more program-centered approach to security risk management?
Program-centered approach to SRM, tick that box. That's exactly what we do. The more specific thing on COVID, yes, I think the crossover, I mean, we have this division between medical and wellness and non-security. We do cooperate closely together, but I think in the future there are going to have to be hybrid individuals who can function on both sides. We did experiment with this back in 5-6 years ago during the Ebola outbreak in West Africa, where we brought on board a specialized team of characters with security skills, but were also all public health, hygiene, nuclear, biological, chemical warfare experts. So they were able to deal with public health issues on the ground in the field, particularly when we were doing mass distributions of food in areas where Ebola was suspected. So, but at the same time, they had a security perspective as well. So we've tried this in the past, and I think, yes, it's going to be something we're going to be looking at in the future for sure.
Right, very good. Thank you for that, Tom. And we have gone a bit over time. I'm so happy that almost everyone was able to stay with us for these additional 10 minutes or so. We're going to wrap things up now. I'd like to turn, though, first to Jeremy for some concluding remarks from his end. And then we'll go around this virtual table and ask each of our panelists for their closing thoughts. So over to you, Jeremy.
Thanks, Ingrid, and certainly thanks to all the panelists. I think as I shared at the beginning, I'm not myself an expert in risk management, so I was looking forward to the presentations and dialogue, and I think certainly that did not disappoint. I myself would say learned quite a bit about different aspects of how security risk management, duty of care are playing out, particularly in COVID response now. So certainly thanks for those presentations. I think maybe just one concluding remark. This is something that strikes me from the conversation and I find personally to be quite important, is back to some comments that I think both Azmat and Stefan raised around this challenge of how we balance duty of care, security risk management with our humanitarian duties to the people we're there to serve. And I think, to me, this is one of those areas where there probably is not a right answer that you can point to, but it's a critical area that I think we need to struggle with as humanitarians when we consider how we manage risks appropriately and continue to meet the needs of the people we're there to serve. So to me, that's both a takeaway and perhaps a concluding remark, just to reinforce the need that we struggle with that question. I think really a critical one that we think through, keeping in mind that one, there's no such scenario where we manage risk down to zero, but I think also we consider some themes that Azmat raised around subcontracting and how subcontracting looks very different from partnership. And I think the former leads us down a path where we do have increased issues with things like risk transfer or dumping, I would say, perhaps less of a concern than we should for security risk management or duty of care in a contractual relationship versus partnership, so good to consider that. And as I said, finally, we just really, it's important to consider the model of how we work in terms of the effects that can have on the population that we're trying to serve as well. So when we do struggle with balancing things like duty of care, security risk management, I think that makes us more effective humanitarians as well. So that's a key takeaway for me in terms of what I can think about myself going forward, and hope that would be relevant to others as well.
Great, thank you, Jeremy. And now I'd like to turn first to Stefan. Do you have any concluding comments that you'd like to share with the group today before we wrap things up? Over to you, Stefan.
Just to continue this more internal analysis and to share that with the audience, I think for us the COVID-19 response has shown has put the light on a few cracks that we have in the system that we were not prepared for. Cracks that we normally don't see, but they got bigger and more visible during COVID-19 because this was out of the ordinary. And we have, as a response to that, we have really tried to, and now launched an internal review and lessons learned mechanism to look internally, but also externally. What did we do well? What did we not do well? I think that is an interesting exercise for us, but I think it's probably also an interesting exercise if we can talk about these lessons learned in a free and competitive free environment, so that we really all together get stronger and better prepared for the next one, because this is one of the things we take with us, that we need to have also mechanisms in place where a next pandemic is addressed more as part of a setup than hit by surprise. That is something I think we share a lot with the UN. I think we a lot with national NGO partners on the ground. And I think, as colleagues have said, the more we share, the better it is for all of us. And I think that would be really also this forum here, an element to contribute to this, that we see this as a joint effort and we open up the cards of what did we do well, what did not work well. We share it internally and we share it externally. I will stop here.
Thank you, Stefan, and thank you for your contribution today. It's been terrific having you with us in the conversation, and we look forward to continuing it in other fora. Now to Azmat, do you have any concluding thoughts that you'd like to share before we depart? Over to you.
Thank you so much. I'm thankful to all the presenters and all the audience who had been staying with us. If I summarize my understanding of security risk management and duty of care, my understanding is that putting just a person for the security management inside an organization is not SRM. This is This needs to be integrated to the overall programming of organizations, and it needs to be made culture of the organizations, like it needs to be a culture of organizations. For this, as I presented in my presentation, that this is a resource intensive thing and it requires resources. So whether we work with a small local NGO or a medium NGO or an international NGO or the United Nations, all of us, we need to be compassionate for each other. We need to advocate for each other, specifically when it comes to mobilization of resources, as well as sharing the expertise with each other well on time. So that is my understanding of SRM and duty of care. And thank you so much.
And thank you, Asmat. Now to Tom. Any concluding remarks from you?
Thanks. Concluding remark. Sharing information. All organizations struggle with this, especially security-related information, but it should be a trend that we share more in an environment where trust and cooperation should be growing all the time. And just to quote the former JSOC Commander General Stan McChrystal, who said, it is more dangerous these days to share too little information than to share too much. Thank you.
Excellent. Thank you. Great to have you with us. And last but not least, Lisa, the floor is yours.
I think that pretty much everything has been said. I suppose what I would add is what we often forget about risk management is that it provides us with an opportunity as well as a challenge. And while these are very challenging times, there are opportunities for us to improve the way we work with partners around security risk management, to really open up the conversation with donors, and as Tom said, to work better together, because this is an opportunity for us to really improve how we do security risk management so we can continue to deliver humanitarian programs. Thank you.
Thank you, Lisa, and thanks to all of our panelists for taking the time to be a part of today's event. Very much appreciated. And thanks also to Jeremy for serving as co-host, and for the teams both on the ICVA side and the PHAP side for all of the preparations before the event and today behind the scenes to make it all possible. A recording of today's event, both in video and audio-only podcast format, will be available on the event page in the coming days. You can find that there soon. You'll receive an email notification when it's available. And while you wait for the next session in the learning stream on risk management in practice, there are some other events coming up in the next days on related topics that might be of interest to you. You can join us on Friday, the 5th of June, for further discussion on risk management when NRC is launching their new toolkit for principled humanitarian action, which looks specifically at counterterrorism risks. That's this Friday, 5th of June. Then on the 11th of June, next week, we'll be looking at another angle of risk in terms of the potential for putting people at risk when carrying out protection activities and what can be done to avoid putting people at risk. So please do consider joining us for those events. You can see the links to the event pages and the links to the registration pages there on the screen. Also, as mentioned, we will be following up with today's speakers to see if they can answer some of the additional questions that we didn't have time to address live today. We'll be posting those questions and responses in the PHAP online community, where you can all continue the discussion until the next event. So with that, again, big thanks to everyone, and particular to all of our participants today for their active contributions as well through the polls, through the chat. Great to see such a lively discussion during the event. We look forward to welcoming you next time. And in the meantime, this is Anne Lang signing off from Geneva. Thank you. Bye-bye.